Welcome everyone to our first progress report. My PhD is focusing on oral contraceptives and cancer risk. I'm Tímea Hercsik, a medical doctor and a first-year PhD student. My vision is to lower rates of malignancies, and my mission is to provide preventive measures for hematological and lung cancers. Currently, I have two ongoing projects. The first one is assessing the relationship between oral contraceptive use and the risk of hematological cancers, and the second one does the same in terms of lung cancer. But why is this topic important? Well, there are more than 150 million women worldwide who are using oral contraceptives, and besides, cancer is the leading cause of death with a rapidly growing incidence and mortality. So revealing any kind of association between these two factors can have a huge influence on women's health. But there are still conflicting results in the literature about the association, and more importantly, a fear among women about using hormonal contraceptives. So my first project is investigating the effect of oral contraceptive use on the risk of hematological cancers. Hematological malignancies include a wide variety of cancers affecting the blood, the bone marrow, and the lymphatic system. They can be divided into lymphoid and myeloid origin, and malignancies of lymphoid origin can be further divided into Hodgkin's lymphoma and a more heterogeneous group of non-Hodgkin lymphomas. And the malignancies of myeloid origin are also a similarly heterogeneous group. And while the incidence is increasing, especially in developed countries, women generally have lower rates. And this could be explained with a variety of factors. The observed higher cancer risk in men has been attributed to increased exposure to environmental carcinogens, such as smoking and alcohol consumption. But these are major cancer risk factors, but they can only offer a partial explanation for the sex-dimorphic differences in cancer risk and outcome. Therefore, it is very likely that intrinsic differences in hormones and genes are also play a huge role. And sex hormones are known to play a role in hematopoietic stem cell development. They control their self-renewal, their differentiation, and proliferation. And given that estrogen has been shown to have a protective effect against hematological cancers, and the most often used combined oral contraceptives estrogen component is ethinyl estradiol, which is the most potent estrogen, we would like to investigate the association between oral contraceptive use and hematological cancer risk. We hypothesize that oral contraceptives decrease the risk of hematological cancers. We use the PECO framework, and we would like to investigate women who use oral contraceptives and compare their hematological cancer risk to women who do not use oral contraceptives. And so we can provide an informed choice of contraception. Here I would like to present you the search key of the first project. It consists of two domains. The first one is created for the exposure, and the second one is for the outcome. We conducted our search in three databases, PubMed, Embase, and Cochrane Library, on the 23rd of November. We already completed the duplicate removal, and we just finished the title and abstract selection. And now we are starting the full text selection with my co-investigator. So let's move on to our second project, which is investigating the effect of oral contraceptive use on the risk of lung cancer. Lung cancer incidence has increased in the recent decades in women. In 2022, lung cancer was responsible for close to 1 in 8 cancers diagnosed and 1 in 5 cancer deaths. So it's the second leading cause of cancer death among women. Cigarette smoking is one of the greatest risk factors for developing lung cancer, and within the smoking population, men are more likely to develop lung cancer. However, among non-smokers, women are about 2.5 times more likely to develop it at a younger age. These differences have been also attributed to sex steroid hormones. Estradiol has been shown in vitro to induce the proliferation of lung cancer cells, And in animal models, progesterone was able to inhibit their proliferation. These observations suggest that sex steroid hormones may have an effect on the pathogenesis of lung cancer, but their role remains unclear. Therefore, we would like to investigate the association between oral contraceptive use and lung cancer risk. We hypothesize that oral contraceptives increase the risk of lung cancer. We use the same PECO framework. We wish to investigate women who use oral contraceptives and compare their lung cancer risk to women who do not use oral contraceptives, and so we can provide an informed choice of contraception. Here's the preliminary search key for the second project. It also consists of 2 domains. The first one is created for the exposure, and the second one is for the outcome. And we conducted our search in 3 databases. There's a previous systematic review and meta-analysis, which has articles up to 2019, but several studies came out since then with different conclusions, and there's no dose response nor time response relationship was assessed in this paper, and there's no Prospero registration. Here I would like to present the key articles for the second project. All of them are cohort studies and have their measure of effect in hazard ratios. So, in summary, we would like to submit both of our studies until the end of next year, hopefully. And I would like to end my presentation with a quote from Marshall McLuhan: "Whoever discovered water wasn't a fish." And thank you for your kind attention.
Thank you, great presentation. I would like to ask for the first project, is there a previous meta-analysis, and if so, what are the results on it?
The first project?
Yes.
There's no previous systematic review and meta-analysis.
Okay, thank you.
Hi, nice progress. I have a question that do you plan to differentiate between the different oral contraceptive medications? As we know, there are many, maybe for a subgroup analysis, or how do you plan it?
Yes, we are planning to make subgroups, of course, if we have enough data available. But we are planning to do subgroups for the type of oral contraceptives, the duration of use, and also the subtypes of the cancer. I mean, would you like to hear it, or?
Of course. But thank you. Okay.
Congratulations for your presentation. I was just wondering that, so does it matter that how long do they take the oral contraceptives, and also that in which age? So is there a subgroup analysis for that, or?
Hopefully we are going to have, but if of course if enough data will be available, but we would love to do that analysis for the duration of use of contraceptives.
Okay, and so, what do you think, that are you going to look in years or 10 years, or what's the
years, like 1 to 4 years and 5 to 10 years and more than 10 years. It depends on the paper, and yes,
okay,
how
thank
they
you.
report the data.
Hi, do you know any other cancers that are more prevalent in patients who are using oral contraceptives? So any other types of cancer?
Yes, I'm not so sure, but I think the hepatocellular carcinoma is more common in women who are using oral contraception. And I think the pancreatic cancer also.
Thank you.
I would also want to ask if there any association with lifestyle factors and the type of contraceptives do women use, if we know anything which could influence the cancer risk in lung cancer.
I mean, I think yes. I don't know. I hope we can control for that, but yes.
Thank you.
Just a comment. First of all, congratulations, an excellent presentation. But I would just like to comment on, before anyone goes back home thinking that taking oral contraceptives is such a risk of things, as far as the cancers are regarded, oral contraceptives exert a lot of protective effect against various types of cancers. So the overall balance will be for sure beneficial. And these are the details that we have to go into, whether these hematologic cancers or lung cancers, and we go through all the other types of cancers. But the overall balance is on the good side.